Hi, I'm here to talk about COVID-19 emergence, children's service recovery, planning and responding to change. This is in respect of building business resilience through COVID-19 and specifically in relation to children's services and variations within that subsector of under 18s, special schools, charities and other areas that would fall under the children's service categories. My name is Charlotte Rowe. I am the Care Practice Manager for Markel Care practitioners. We have 30 practitioners around the UK who continue to work virtually through the COVID period. We have a range of skills in our associates. They have experience in children's and adult sectors, charitable, education, government-based, inspectorates, and other areas. I will speak a little bit more about what we do at the end of this presentation. Presentation today will look on a few aspects that we feel are essential to developing business resilience and ensuring that your business and being able to help young people and children remain at the centre of what you do and can survive the COVID period. We're going to look in specific areas: recovery planning, whether your service and provision has had to close during the COVID period, or that it may be emerging on the other side in regards to you may be considering recovery planning, unfurloughing staff, or whether you have just been carrying on with certain restrictions. We look specifically at risk management strategies, and while this is something we know that is done consistently in the sector, we look specifically around risk management, the need for robust risk management processes, risk assessments, and key factors to consider when undertaking those. One of the key factors that's been in play during the COVID crisis is consideration of governance. We must consider that children's social care and children's services have obviously taken a slight back seat to elderly care and government guidance in respect of adult social care. We'll also be looking on factors that relate to PPE and an overarching strategy in which PPE is connected, which is infection control. Finally, we will look at aspects of liability reduction, your duty of care as an employer, and tips and tricks on how to ensure reduction in claims to make sure you are as defendable as possible. As it is an emerging and changing landscape that we're in, it's important that we're prepared for any potential claims that may come in either now or in the future. So just having a look at where children's services are currently lying. Obviously, children's services are a range of different services. This may be from special educational schools, school provision, childminders, nurseries, nannies, right through to children's homes, foster care agencies, and specific provisions, whether it's daycare services, community services, charitable services. So please bear in mind when considering this guidance that there are specific aspects of each of those subsectors that would need to be considered. Whilst I can't speak directly as to certain aspects that your business may need, obviously Markel Care practitioners can provide that bespoke support. Whilst not everybody has experienced complete business interruption, most organisations have experienced some form of restriction, whether that be not being able to take young people and children on activities, whether that's not using community resources. If you're a therapeutic intervention, you may have to employ different types of social distancing. If you're providing any form of personal care, obviously restrictions in regarding PPE. So business interruptions will mean something different for each service. But what we're talking about specifically is the new normal. Not just during the difficult few months that have passed, but what will the emergence of children's services look like? Whether you are a sole provider, such as a childminder, whether you run nurseries, and as there is a turn to the use of this service, it's really important that you consider recovery planning. And that proactive approach, which we will discuss, is essential being an effective service and ensuring business resilience. COVID-19 is seeking to continue while there is a lot of hope that things would return back to normal within a few weeks, the echoes of this pandemic are going to be with us for foreseeable weeks, months, and potentially a year. So it's important that we make plans and we start to understand whether there is significant uncertainty on how you move forward as a business. It is essential in regards to planning that you consider a multifaceted approach. Business resilience. So we want to break this down into 5 subsectors. Business resilience is essential, and it's what's the difference between a business that may survive through COVID-19 and those that may not. Recovery planning is about considering where you are now and considering where you will be in the future and committing to a plan, whether that be phased transition or a stepped approach of moving forward. It may not mean going back to work tomorrow, but what it will mean is that you'll be able to prepare, and at the correct time, where the risk is then manageable, you'll be able to get back to work as soon as possible. Risk management. Across the sector, I don't think there'll be anybody who hasn't done a risk assessment. They are commonplace within social care and health, charities, and it's essential that we have clear risk management protocols and that we're considering some of the nuances that COVID-19 presents us. PPE competency. PPE has been the subject of many of the inquiries that we have gotten since February, whether it be regarding supply or do I have to use it? Obviously, each business and service is different, and there are certain things that must be considered. Competency is essentially a robust way of testing whether people understand what to do, both in the use of something and also when it goes wrong. It provides some defensibility and also enables training and support for those who are using it. Guidance. We're talking in respect of government guidance, but there are other forms of information out there, and it's essential to remember that government guidance is a minimum standard. Liability reduction. Claims are going to come in. That is one thing we are sure of. And it's important that we remember that essentially liability reduction is not only about reducing claims, but also considering your insurance at renewal. We're going to start with recovery planning. One of the essential elements of recovery planning is the consultation process. So whether you've maintained your service with restrictions or whether you've had to have been to considerable business interruption during the period, consultation is essential. This is not just consultation with service users, families, stakeholders, but also with your workforce. It's important to understand any challenges or barriers that your workforce may experience. And also essential that you kind of factor all of that into your plan. As well, what one risk or consequence of COVID-19 may be for one worker, there may be something else for somebody else. And if you cannot get your staff back to work, then your business itself also will suffer. Planning is essential. And doing the hard thinking before actually actioning a plan is a good way to start. Making sure that you have everything you need to start means that you can be proactive in your planning, and then when the timing is right, you can make changes and transitions. Again, return to the workforce, staff needs. The well-being of the staff is essential. We'll talk about staff well-being throughout this. It is important that you continue to train your staff with any changes that may have occurred during the period, and make sure that communication has been regular, especially if staff are furloughed. Even if staff have undergone changes, for example, working from home, it's important to check on their well-being. Outside of work, people may have caring responsibilities, children off of school. This can affect productivity, but also can mean that staff will not return due to those commitments or potentially other factors such as emotional illness or stress. Consideration needs to be of supply chains. Whilst we think about this currently in regards to PPE and the issues that have been faced across the sector, it is really important to bear in mind that supply chains also may be totally different things from clinical elements. If you provide personal care, there are a range of things that could be supplied to your service. If you provide outreach, there may be a range of things that are provided to your service. You need to think what your procurement is and whether, due to limitations in logistics and other demands on supply chains, can you still get those? You may want to start ordering them prior to your business going live or prior to a transition point where they may be needed. Governance. Governance is really important, and regular reviews of the issues facing your service is essential. You need to make sure that you're working with up-to-date guidance, figures, and any information such as consultation, communication from staff. Having regular review points enables you to act faster and with more accuracy in your decision making. Competitors and diversifying. A lot of people, when we've spoke to them from Markel Care practitioners' perspective, have said, well, our competitors are doing this. Each service is different, and it's important that you consider the risk based to your service. And while a competitor may be moving ahead, there may be nuances in your services that mean the risk that is too high. However, do bear in mind, as part of your governance plan, it's important to understand what other people are doing. That may be from multi-agency perspectives and other partners that you rely on within the sector. Diversifying. We have seen quite a few community services who have diversified. For example, they may have delivered activities online virtually. You must consider whether this remains within your statement of purpose. It is always better to have further discussions with your broker or insurers in respect of diversifying and making sure that your statement of purpose remains up to date. There may be additional risks, regulations, and insurance capabilities that needed to be considered. In regards to recovery planning, we advised a transitional and phased approach. This means taking small steps with triggers in between those steps. Whilst for some organisations, they can't yet return to work and there isn't guidance about how they should do so. What phased and transition planning allows you to plan proactively while still not knowing that information. If you can do a robust risk assessment, you can determine what factors would need to occur for you to move to an active state. If you are already trading and continue to change, changes within the restrictions you have got also will see those triggers. And that enables you to move forward, maybe expand your service, maybe diversify, or return to that place where we call new normal. Throughout these slides, I will present case examples. You'll be able to look back through these and consider. These are things that we have done for clients and things that we have seen through our consultation with clients over the last few months. Certainly creating recovery plans is something that we have focused on probably in the last 6 to 8 weeks. And it's really important as there's a lot of uncertainty about what guidance do we use, who do we have discussions with, what's the first step. So we do find a lot of the smaller providers need specific help with their recovery plans. And again, these are unique documents specific to your service. Risk management and assessment. As I said previously, I think we are all very accustomed to the concept of risk assessment. It's something we do daily within children's services, regardless of what type and subsector we're in. What needs to be considered is COVID-19 related risk assessments. This may require subtle nuances between risk to and risk from. We have had experience with clients where they have undertaken risk assessments of service users, say with underlying health conditions, but haven't then considered the risk from the service user contracting COVID-19 back to the employee. So it's important to cross-examine and really look and scenario test your risk assessments, not just from a risk from, but a risk to each other. So when you're thinking about people who may enter your service, this may be in an office environment. Say if you were in a fostering agency and you may be still doing everything virtually. If you were undertaking field work, those risks get greater. So it's really important that you kind of run through the scenarios that your staff and your business do as critical operations. Furthermore, to considering risk assessments is environmental risk. Unfortunately, even in COVID-19, health and safety risks have not reduced. And whilst you may not be using your office space, community hall, that doesn't mean that you shouldn't do a risk assessment in preparation for use, but also consult as to whether there's any changes that have been enforced by government guidance and social distancing. If you're using a shared space, you need to consider potential hazards of other companies, other people walking in. If you have service users, delivery drivers, the postman coming to a site, what are the risks for each of those? And additionally, if you provide care, you may have visitors coming. For example, if you're a children's home, do you have parents visiting? Do you have friends visiting? You might not at the moment, but consideration of that within a risk assessment is a really good mechanism for considering those trigger mechanisms for your recovery plans. Visitors and deliveries. Obviously, it's not just, service users, employees who attend sites. And therefore, you do need to think about who else may be attending. For example, fire risk assessments must still be done. You still need electrical assessments. You still need to do environmental risk checks. You may need maintenance on site. You must consider the risk posed, not just to the person attending, what you're going to ask them to do, whether they need to sign in, whether they need to wear PPE. Do they have an underlying health condition that means that they can't wear PPE, but they can still operate their job? Is that a risk to the service? These factors all become more complex. Vulnerable staff and service users. Across social care, risk assessment of vulnerable service users with comorbidities, complex health needs has generally been accepted as required. Vulnerable staff have been shielding with letters from their doctors. There has been consideration through some of the inquiries that we've got as to the risk for a staff member who is shielding to return to work, the risk of their mental health if they should not return to work. The other thing that may want to be considered is an agency member of staff coming in. Is there a risk there? On top of all those factors, you need to consider duty of care. What is your responsibility as an employer? Disclaimers just won't do. Health and safety must continue. And you have to make sure that your employees, visitors, and service users are all safe on your site and are accessing your service. Obviously, risk assessments and understanding new risks that may come out of COVID-19, all factors to be considered. One of the key things that we're being asked repeatedly is in regards to learning disabilities, those with capacity issues, and the presence of PPE. Obviously, anything that covers your face, such as PPE, can create communication problems. This can then see spikes in restraints and behavioural issues. It is worth considering this, and it does not mitigate the use of PPE. However, you may want to consider a different strategy. There is good advice from the Social Care Institute of Excellence in regards to the use of PPE in these service user groups. PPE and infection control. The basis of this is follow the guidance. If you are not sure whether the guidance applies to you, as you are a nuanced service or a service that does not have specific guidance, then the best thing you can do is speak to Public Health England. Public Health England are there to field those calls, and they will provide you with the advice that you need. You need to consider PPE as part of an overall infection control strategy. PPE itself is not solely the only strategy employed, and you may want to think about disinfection, logistics, other factors that are relevant to your service. If you have had business interruption to such a point you have not been operating your service with service users, you may want to consider early supply of PPE, ensuring that you can then restock on this and have this in advance. We have seen many services who have continued throughout the last few months ensure that they have hubs at certain localities where they can stockpile PPE and then get it out to people and different elements of service as it is needed. One of the significant concerns is not just the use of PPE, how to use it, and that should be instructed and underpinned by training. and competency, i.e. testing whether people know how to use it, but also the potential for PPE failure. There is a certain level of standard and quality of PPE that should be used. However, where we are working directly with people and service users, there is the potential that PPE can fail, either because it fails or that it is ripped off or it is broken or something occurs. This is then an accident or incident. It's important that staff should know what to do in these incidences. PPE competency, which is similar to considering medication competency, a test that you must do to prove that you understand the use of what you are doing, provides a backbone to making sure that everybody knows what they should do, whether there is a failure, whether there is an incident. This also can provide some liability reduction and defendability should a claim arise. Understand what your responsibility is. And again, in respect of government guidance, there is always NHS guidance, Public Health England. It is essential that you understand in terms of your service and your service users what you should be using. And do remember that government's guidance maintains a minimum standard, not a maximum. Ensure that you understand any issues in regards to the use of PPE with vulnerable staff and service users, who can and can't wear a mask and what the potential repercussions of such is. Also consider disinfection, sanitizer. That may also have issues in regards to people with certain emotional behavioural difficulties, OCD, skin conditions, and other issues that may be complicated by these matters. There is some factors for some elements of social care services in which PPE does not need to be used. That is not saying that PPE does not need to be used in children's services. Concepts of household need to be really carefully considered. And again, if you are unsure, you need to go to Public Health England. Whether you are a household and not using PPE, it is important to consider whether you do need to use PPE if you are outside of that household, how many staff are coming in, suppliers, etc. So it's really important that you have a full infection control strategy, not just consider we're a household, we do not have to use it. This applies specifically to children's homes and special schools that may have residential elements. Government guidance, keeping up to date. Government guidance has changed and there is considerable versions of government guidance. What is clear is if you are on the wrong version, it will tell you at the top of the web screen. If you take the link and embed that in a document, it should always provide you the updated version. You can also set alerts to your email from the gov.site, and this will ensure that if there's any update, especially in regards to adults or children's social care, this will come directly to you. Lacking guidance for your service. We know that children's services has somewhat been an afterthought, with a lot of focus on adult services in hospitals. Due to the fact that it wasn't considered that COVID-19 posed specific risks to young people, and given the impact on the elderly, information from our clients has been that there has been very little guidance that is of use. Therefore, we have seen children's services relying on guidance for residential homes and domiciliary care. If you do, again, lack guidance for your service, you need to have a look at other potential sources of information. Public Health England are a good starting point. Local authorities also should have clear pathways for you to seek information, as will NHS trusts. Furthermore, don't just think about guidance coming from the government. It's also important that you rely on best practiced institutions, whether this be the NSPCC or other organisations such as the Social Care Institute of Excellence, NICE Guidelines, HSE. There are many different places in which you can find information. Regulators as well provide updates. And depending on the information you seek, if you are using any restraints such as NAPI or Studio 3, there will be updates in respect of that. Review. Make sure you review the government guidance. It is not just about governance guidance for your sector, but if your service users, young people and children interact with the public, you must also understand the strategy for public safety. So it's important. If you are work normally within multi-agency practice groups, it would also be helpful as part of your governance strategy to consider what your partner agencies are doing. For example, if you are a fostering or children's home, you may want to consider what are the long-term plans for social workers in respect of the local authority. Whilst many social workers are working from home, how are they going to undertake statutory visits, LAC reviews? It is really important that you understand how your key partners are also working, because this allows you to make decisions about your working practices. Liability reduction. Liability reduction is about reducing the potential for claims. That's not just claims, but that's also a bit about being defendable to claims and potential claims coming in. It is essential during such a period of change that all services implement good record keeping, and ensure that any changes are reflected in decision making, policy, training, and then in the record keeping skills of those implementing it. Staff training and competency are essential. It is important that you keep up to date with mandatory training for all of your staff, and also implement training where there are changes to ways in which you practice. This goes back to competency levels. Keeping a record of those where an incident does happen and staff has been trained on it, then can be included in accident incident reporting, and then may provide defence for a claim. Communication. Do not just email out updates in processes and expect employees to read them. This is a really dangerous communication strategy. It is important that whilst you disseminate information, that you are checking to see whether the workforce understands what you are asking of them. Do you remember this is a time of great change, just not in employment, but also at home? For many people have children at home who would not normally be there or may have caring responsibilities. If you are just opening up, whether you be a nursery, childminder, school that's planning to go back into in September, it is really important that you consider communicating with everybody. Even if it is that you haven't formulated your final plan, it's important, going back to the recovery process, that you have that consultation period, and that you are seen to be really checking up on the people who use your service. As often, for some of them, especially with children and young people, you may be their only point of contact. Understanding the impact of change. As I said before, everybody is undergoing change, not just in the sector who are dealing with the most vulnerable in society, but those who work in the sector. It's an absolute privilege to see the resilience of the people who work in children's social care. However, it does have a toll and an impact. Remote working keeps people away from the social interactions that they may find that they usually experience via work. This can lead to other issues such as mental health, emotional health, and potentially long-term sick. So it is really important that as part of consideration of your staff well-being, you also consider the impact of change in the working arrangements. Planning and governance. Again, this is all about your oversight, your QA, and your decision-making process. It is always important to consider what information we rely on, do risk assessments, and ensure that those can be evidenced at a later date should a claim come in. Markel Care practitioners continue to offer liability reduction training. We do this virtually so as not to impact with any additional risks, but ensure that you can mitigate and manage claims that come in. And there is a focus on COVID-19 and some of the potential issues that may arise. Safeguarding and regulation. From the contacts I've had with clients throughout children's sector, there has been varying degrees of positivity as to being able to get hold of local authorities and safeguarding agencies when required. Obviously, that is of concern, but we must continue to push ahead, and safeguarding remains central to what Children's Services does. In addition, regulation from regulators such as Ofsted has had very limited interaction. While Ofsted is still functioning, they have certainly and dramatically reduced, if not halted, their inspection Therefore, those are not going ahead. However, if you are a children's home, you are still expected to take Reg 44 visits. These should be done virtually, and the regulations have not changed. There is no additional guidance in place. There are certain changes as interim measures that do relate to legislation, such as the Mental Capacity Act. And if you are using any of these actively within your service, please review what changes have been made. Consideration must also again be made to Health and Safety Executive. Most regulators are clear on what their functions are and any interim changes. Again, you want to keep up to date with what the regulators are asking from you and ensure you're compliant. We have undertaken Regulation 44 visits for some of our clients during the COVID period. We do these virtually. One of our Ofsted inspectors actually contacted us due to the nature of our Reg 44 visits. Their testimony is seen on the slide below. Obviously, children's lives don't stop during COVID-19. And therefore, we pride ourselves as Markel Care practitioners to continue to deliver the high standards of care, as we know are delivered across the children's services sector. Markel Care practitioners continue to work throughout the UK. My team works virtually and is able to support you with a specific COVID-19 toolkit. This is designed and delivered on a bespoke basis because we understand that every service is unique. The issues you may be facing may be different from that of other people in your sector. We have 30 associates across the UK. They have ranging skills. They can be ex-inspectors, children's services, social workers, nurses, RMs. So we have a whole bunch of expertise that we can rely on. Bespoke support means that we understand what you do. We understand that each service and each service user is different, and therefore we are there to support you on an everyday basis, but also when times get hard. Access to Markel Care practitioners can be through your policy. However, we can also provide additional services outside of that. We ensure that we match the expertise of our Markel Care practitioners to what you need as a service. And we understand that humans are complex, young people are complex, and so are children. Therefore, as a service, you will have complexities. So, just a review of the key messages. Advice and support must be unique around the nature of your organization. That's not to not worry what other people are doing. However, you need to focus on you. It's essential that you consider the nuances of your service, your operations, your practice, any clinical practice, the nature of your location, logistics, and consider that in a multifaceted way for your risk assessments, governance plans, and recovery models. Do review risk assessments regularly. Guidance has changed throughout this period, and therefore risk assessments must be updated. Whilst it may be additional work, it is important that we reflect the risks and then practice can emulate any issues that we feel are there, and then risks can be managed and mitigated. Communication and support your workforce. Children's social care workforce has generally continued working throughout this difficult time. Even when furloughed, people are eager to get back to work and support the young people, families, and children that they have dedicated their life to. However, there are additional stresses on people, both on a personal and public level. So it's really important that you consider the well-being of your workforce. Ensure that you communicate with them and ensure that you listen to them as well. If you're in doubt as to what guidance or any factors in regards to PPE, what you should be doing, testing, you need to go and have conversations with Public Health England, local authorities, and NHS trusts. There is diversification in locality-based strategies, and it's important that you, as a service within that, understand what your commissioning group is seeking to achieve, and then you should get the support from them too. Ensure that you hold regular planning review meetings and assess change regularly. Use scenario testing. Do not be afraid of gap analysis, and do not be afraid to respond to change. If something isn't working or a risk is identified, reassess. Move forward. Thank you for listening. I hope it has been helpful. Visit our dedicated COVID-19 hub, where you can access information in regards to FOLO and frequently asked questions, downloadable coronavirus job retention scheme and FOLO booklets, and sign up to more webinars, which we will provide as we move through this situation. Most importantly, we offer free legal support and guidance through 1 month's free Law Hub access, which will include guidance letters, templates, employment contract templates, and other documents you may find useful. Markel Care customers already have this great benefit as part of their policy. Once again, thank you for listening. I hope you stay safe and well.